Hello, my delicious co-creators. Lilu here at the Dao Garden in front of the Pakwa Clinic with one of the doctors here. Again, I'm all the way north in Thailand in this beautiful place that 20 years ago Mang Shia created. And I'm sitting next to a doctor, a non-ordinary doctor, though you have quite a regular, I would guess, doctor training, right, William?
Yes, that's correct. I studied Western medicine and then advanced my training through naturopathic medicine and with Chinese medicine. So though I hold 3 degrees, I prefer to use my natural or Chinese medicine ideas first and foremost in treating people.
Yes, and so you're from Chiang Rai originally, which is about an hour away, is that right? Or you practice there? You work between here and there? Tell us about your life right now, because this is quite interesting, even for the doctors watching or people that want to change career or really live their dream or live something not as conventional.
Right. Currently, I work as a full-time doctor at a university hospital in Chiang Rai. University name is Me Phan Long. It's very pleasant. It's very beautiful. I'm not from Thailand, though. I'm not a Thai person. I'm actually a Pacific Islander, half Jewish Pacific Islander. I am, unfortunately, right now an American citizen, but I am trying to...
Unfortunately?
Yes. Well, if you understand the way things are in the world, you would say the same thing. I am trying to renounce my citizenship if I can, but it takes time and a lot of money to do so.
Exciting. Well, we're going to speak a little bit of exactly, we're starting to get in there into the controversial ideas in your field, because I hear a lot of things. You know, I'm traveling around, I interview quantum physicists, doctors that used to be, you know, doctors and operating, and here we have a kid playing, hi, we're doing an interview. And in the end, like, we're a little bit lost. What's true, what's not true? Is there some things that you would like to share in your own experience that would be quite interesting for us to know?
Sure. One of the things working here at Dao Garden, usually we get people who are open-minded to alternative or natural medicine. So there's really not a difficulty in telling people the problems with pharmaceutical or Western, standard Western medicine, because most people are in agreement with it that it is ineffective in many cases, that it is not science-based as they purport, that their testings are also, many of the testings they've done are inaccurate. For example, the HIV test being inaccurate.
What do you mean HIV test, for example, is inaccurate?
It's reported, and this is quite common in the internet. Anybody can find this information that you can test positive, but it could be for any one of 60+ conditions. So it's not so specific that it will always narrow down a particular virus. And the follow-up tests are also considered by those in the know to be inaccurate or even more inaccurate. So here working at Dao Garden, the issue is really not trying to convince somebody Western medicine is not all that it's cracked up to be. It's more in trying to dispel the myths found in natural medicine, so-called natural medicine. For example, the idea that there is an alkaline acid balance in the blood. There is none. That is a total myth. To believe that while fasting, taking in nothing other than, let's say, water or some herbal teas, you can effectively detoxify the body. That is also physiologically impossible. But this is not to say fasting is not effective. It is, in fact, very effective, especially for mental emotional conditions. I recommend that highly. And for stimulating stem cell therapy. This is something we've just learned recently. Fasting, even for 3 days, can stimulate stem cell. What I'm talking about are people that are sold things that are absolutely not true, not based on real physiology. So, for example, quite often I have people come here from other resorts who will say that I just spent a month or 3 weeks or whatever time fasting, and but I still have these issues. Or they've done a fasting time, and then 6 months later, they come back here and they have problems. So if the fasting was so effective in detoxification of the body, why would they continue to have problems? Other things, dietary ideas. Many people that come here believe that vegetarianism is a healthy diet, or the most healthy diet, I'd say. It is an acceptable diet in my mind, but the reality doesn't support that. So here, my job is not so much treating people, it's just giving them information information that they can use, that they can understand. I have to put it in layman's terms or simple terms so they know what's going on. And if they understand what's going on, they can make the correct decisions outside of my guidance or outside of this place. Physician means teacher, and that's how I feel that I am. First and foremost, is a teacher.
Most of the doctors that we see even in Europe, they have very little training on nutrition, or if we go to a dermatologist, they prescribe systematically the same thing. I mean, how do we get out of this loop of the education that the doctor receives and then what it shares with us, and how does this world can change really? Where does it start?
Well, fortunately, there is a way, and it's through education, but also through money, and because medicine is a business. That's the truth. And it's big business, and it's very profitable business. But if you can somehow make staying healthy a business, a profitable business, then you would see that even a faster change. People are getting tired of being told the same thing. If you're overweight, I'm probably almost 100% certain that you've been told to eat right and exercise more. But what kind of answer is that? I didn't go to 6 years of medical school to tell somebody just eat right and exercise more. There has to be an underlying foundation or an underlying root or cause. The Chinese say bao and bian. There's a root and there's a branch. I can cut the branch all day long, but so long as the root remains, the problem remains too. So we have to look at the root cause. And when we look at the root cause, which is the basis of naturopathic medicine and Chinese medicine, you look at the root cause, you can affect the whole course of what's happening to a patient. Commonly now, with the popularity of vitamins and minerals, supplements, these type of things, many doctors are now practicing what I call organic pharmacy. They're applying the same standards to somebody who has a problem. And they're saying, well, just take this or just take that. Again, you can replace a natural product with a pharmaceutical product, and they're saying basically the same thing. When we look at the root cause of the issue, we then are addressing what is really starting all of this. It's a lifestyle issue or a dietary issue. And when we start looking at this, we can see profound and lasting results in helping someone out. And unfortunately, this takes time. And this takes a willingness on behalf of the physician to explain things to the patients. And many physicians feel they don't have the time, nor do they need to explain, because they'll tell the patient, you won't understand anyway. And I say to them, perhaps you should learn how to explain things better to somebody, because I can explain almost anything, any medical condition to a patient where they understand. And I draw pictures and all kinds of things to assist them. But again, it goes back to teaching them what's going on and getting them to understand that their lifestyle choices are making the problem. Nobody's deficient of a drug. Nobody's deficient of a cholesterol-lowering drug called statins, all right, which are completely dangerous and completely unscientific and I think unethical to issue. But outside of that, if you are to believe the myth that cholesterol causes heart attacks and stroke, if you wanted to believe that, I'd say, okay, by taking a drug to lower cholesterol, do you think that you are going to actually help yourself in the long run? Because if you don't take the drug, what happens? Cholesterol goes back up. So what did we really influence? We influenced an arbitrary number to make you feel better. What would cause cholesterol to go up? This is what you have to ask. What makes cholesterol go up? It's not eggs, it's not lard, it's not bacon, it's none of those foods. They will not influence your cholesterol levels. Cholesterol is an indication of inflammation. And where is the inflammation coming from? It could be from your diet, but it could be from other areas. The thyroid might not be working properly, so let's look at the thyroid. What would make the thyroid not work properly? Diet, again, eating wheat-derived products, soya products, which are not health foods, and such. So, you could have a diet that's messing up your body. And so a doctor must consider all things. This is an old adage in Chinese medicine, too. The doctor must consider all aspects of the patient, all aspects. How's your home life? Maybe you have incredible stress. Maybe you're in a horrible relationship. When you're in a horrible relationship or under incredible stress, whether at work, at home, it doesn't matter, your adrenal glands, which are commonly called your stress glands, release a hormone which impedes thyroid function, which impedes liver detoxification, which impedes proper digestion. So, maybe you have that stomach pain from being excessively stressed.
And that's a big problem for a lot of us. Yeah.
Yes, yes. And how to deal with it. Thousands of years ago, if you had a problem, an event that was very stressful, you would go to the local shaman or whatever, the wise old lady that lives at the edge of the village, and she would tell you, go find a particular flower or go trek over this mountain. And you would do something and you would alleviate your stress. But today, if I was to do that or recommend that to a patient, they'd probably think I'm crazy. But our DNA, our body is designed to deal with this stress, but also have an outlet for it. And today, our bodies are inundated with stress. Stress all the time. Go to bed with stress, wake up with stress. The mind is running constantly. And how can your body decompress? How can your body correct itself when it's worried about another thing? You go to bed with a tiger, you wake up with a tiger. And
how to think clearly, because that seems to be a huge problem now, where we're influenced also by a lot of, by doctors, by those pills that we can take, by our stress, by the publicity, and then we're not thinking clearly on our own.
Right.
And we don't even know where to really look for the real information. That's a huge issue. There's everything for everybody here.
Yes, there's lots of information and there's lots of misinformation. Again, both on the Western traditional side and also on the natural alternative medicine side. People are believing things just because somebody who wears a tie and has some titles past them is telling them it's true. And it is very difficult. This is why I feel it's the job of a physician to explain things. It must make logical sense to somebody. It cannot be magic. A particular disease did not occur just fall out of the sky and it happened to land on you. There has to be a logical progression of what went on.
So there's a psychological aspect to it, no?
Oh, absolutely. All diseases, I think, profound diseases, especially chronic diseases, have a very strong psychological impact. And then you start falling into that pattern of I'm sick because of this, and because of this I'm sick. So it's raining.
Magic powder coming down.
It's the magic powder I talked about. And then people seek alternatives because they're not getting really any real answers from Western medicine. So they'll seek alternative answers. And in some cases, unfortunately, there are some natural people out there that are also, it's business. For them, it's business versus the real genuine care of the patient to say, I want to see this person get better. And I'm not against business, by the way. I'm a filthy capitalist like everyone else. I do believe to be compensated for the efforts. But when you put that effort before patient's health, then you have an ethical problem. Yeah. And you shouldn't be practicing any kind of medicine at all.
And the role of genes and all that, are really genes this fixed thing, or what's your view on that?
In fact, a very easy read is a book by Dr. Bruce Lipton, Biology of Belief. Yes, I think that's correct. Biology of Belief. But there's also another lady who wrote, Molecules of Emotion, Dr. Candace Perth. And what we have found is that what you surround yourself in will determine whether a gene is turned on or turned off. This is why I cannot accept the idea that cancer is gene or genetic caused. Dr. Otto Warburg in 1966 proved that it was a metabolism problem. It was the cells not breathing correctly. So we focused a lot on gene research, mapping the genes and such. There are some things you can blame your parents for. Your height, the color of your hair, the color of your... Yeah, you can get angry at mama and papa for that. But if you develop cancer or diabetes, don't blame your parents. Look at what you're doing and look how you're living. If you're living exactly the same lifestyle that they're doing and they develop diabetes or cancer or whatever, you're just following along in your parents' footsteps and you're turning on the gene to be sick. Whereas if you take a proactive choice in your life and say, I want to be healthy, I don't want to be sick, and so you follow good dietary principles, you clean your body, you have good meditation or clean the mind, which is very dangerous, by the way. If you do all of these things, there's no reason for this gene of sickness to turn on. And
meditation is dangerous?
No.
Cleaning the mind?
Cleaning the mind, cleaning the mind.
In which way it's dangerous?
Through meditation, through Tai Chi, yoga, whatever makes you happy. The Thais call here is samadhi, it's meditation. However, you can...
State of enlightenment.
Well, you know, when what's here coalesces or agrees with what's here, there's no conflict, and you have happiness. And being a prime example of not doing that, I'm a good leader by example of the wrong thing. Yeah, this creates tremendous conflict. This creates tremendous stress in our body. And, you know, whether we get stressed about something is entirely up to us. And how we perceive things is a tremendous stressor on it. If we perceive something that is really not wrong, we perceive it as wrong. And this creates a conflict in our body. Yeah. So.
Any recommendation on a daily basis for all of us, like general recommendations, but things that you would like to advise to us? Because of course there's many diseases out there. There's many things in us that are fighting against each other and then creating more mess in our life. But is there anything that you would like in general that we can follow?
Well, the Chinese said it best. They said, don't think. But if you do think, you must act. So this pensiveness, this over-worry, this overthinking, where I come from, my homeland, they say, don't worry about anything you can't change. Because worrying about it's not going to change it. So why worry? Now, that's easy to say, yes, of course. So we just need to be trained, to be taught. Again, the doctor teaches. The yoga teacher, the Qigong master, they teach you how to deal with these issues. And yes, it is difficult. The Chinese have another saying, the mind is the hardest horse to corral. It is so difficult because we have so many things coming in and so much input and so much excitement and stimulation and things. But really, if we can learn somehow to control this, and I'm not an expert in this at all. I do daily Qigong, Kung Fu, these martial arts and things. I do these daily. I do these as a part of habit. I've done it so long now. It's part of my habit. But simple things. Just look at what's happening in your life and really say, is this important? Is this really that important to work?
That urgent?
Yes, you know, yeah.
Urgency, the sense of urgency.
Right. So the other saying is, don't sweat the small things. Right. It's like, well, why? Why are you creating tremendous stress? And again, we could do a whole hour lecture on the damages of stress and perceptions of stress, what they do physiologically. I'm not talking about just the mental, but actually physiologically, they've measured what stress does. And whereas before, or I'm sorry, I shouldn't say before, even now, doctors accept that a heart attack is this blockage of the coronary arteries leading to death of the tissue downstream. Actually, the research doesn't support that. And this is why stents and balloon angioplasties and such are basically ineffective. What they did find, in fact, was that there was an extreme imbalance in the sympathetic and parasympathetic nervous systems. So the sympathetic is your fight or flight, your stress. The parasympathetic being the rest and digest. And when you get this big imbalance occurring in these two systems, there's some triggers that happen. And so this is what Western medicine found out. And yet they still stick to this dogma that, you know, because you ate too much bacon, your heart got blocked. And it's nonsense. It's utter nonsense. So we in a roundabout way, they verified that the stress is what's killing us. And again, Bruce Lipton will mention that too. There are other studies that will mention this. The amount of stress we put on our body for prolonged periods of time. Again, the human body is designed to deal with stress. The tiger comes out. If we don't get stressed, we get kitty food, right? We you know, the tiger is happy we were there. But if we have tigers 24/7, other systems in the body shut down. And if we look at it from a long-term DNA result, you know, 10,000 years ago, if we didn't respond to stress, we died. And so this is built into our genetics, okay, for survival. But today we have constant stress, we have constant problems, we have all these things going on, and the body is only responding the way it's supposed to. It's not the body's fault. You know, we can't blame the body for doing what it's supposed to do. And you start responding to the stress, so you have to look at it this way. If a tiger jumps out and at the same time you inhale a bacteria, what do you think the body will deal with? It's the tiger, of course. So hence, the immune system is told to wait. I have a tiger, let me deal with that, then I'll deal with the bacteria. But when we're under stressful conditions 24/7, it's always, I have a tiger. And the immune system declines, digestion declines, normal body function declines. This is just, again, our DNA. It's the way we're wired.
Mantak speaks a lot about the having a clean blood and clean cells. Are you fully on with everything that he's teaching?
Yes, of course. Blood is our life, and so it carries our nutrients around. Blood, being a colloid or a suspension, blood carries things. And if we're under tremendous amounts of stress, whether physical or emotion, the ability of blood to carry declines. Its electronegative charge decreases. And when it's not able to carry things, you create nutritional deficiencies at the tissue, all different tissue levels. You're not able to carry oxygen as well. So a lot of things start to cascade down. So cleaning the blood is very good. And we don't clean the blood directly. We don't pull it out and run it through a filter or something and then push it back in there. That's something else. That's called dialysis. What we're doing is supporting the organs that clean you. For example, the liver, the colon, the lungs, the kidneys, the skin, all of these things. So that's detoxification or more of an environmental situation. And then at the same time, educate the patient on, hey, stop eating products from China. They're full of pesticides. Try to buy organic, and stop smoking or whatever they happen to be doing. So again, educating the patient on not continuing to put toxins into the body, and at the same time assist them in detoxification.
Yeah. And here obviously you have all the whole colonics and everything that we can do a whole video about that. I guess you support the colonics.
Sure, why not? I don't support excessive amounts of colonics, but it depends. If somebody,
to what extent, for example?
Well, typically, through my training, a course of 8 colonics is usually more than enough that someone needs within a given period of time. However, if you have regular bowel movements, you're not constipated, 1 or 2, that's all. And more importantly, you should detox at home. And people ask, what is the schedule? I say, well, the schedule is usually the change in the seasons. We used to be, very outdoors people, and we were very in tune with the seasonal changes. And I say, just clean your body, do some changes during nature's changes. And many systems support this idea. I think it's a very common idea.
Thank you so much. I feel we could speak for hours, but thank you very much, William. It was a delight meeting you, and I wish you a lot of success in your practice. Thank you.
I hope you have a wonderful time here and a safe trip back.
Yeah, it's going to be hard to go back home. Such a delicious place. Much, much love, my delicious co-creators. Wishing you great success in your health, should it be vital. And good. Much love. Bye. Hello, my delicious co-creators. Lilu here at the Dao Garden in front of the Pakwa Clinic with one of the doctors here. Again, I'm all the way north in Thailand in this beautiful place that 20 years ago Mang Shia created. And I'm sitting next to a doctor, a non-ordinary doctor, though you have quite a regular, I would guess, doctor training, right, William?
Yes, that's correct. I studied Western medicine and then advanced my training through naturopathic medicine and with Chinese medicine. So though I hold 3 degrees, I know to be inaccurate or even more inaccurate. Here working at Dao Garden, the issue is really not trying to convince somebody Western medicine is not all that it's cracked up to be. It's more in trying to dispel the myths found in natural medicine, so-called natural medicine. For example, the idea that there is an alkaline acid balance in the blood. There is none. That is a total myth. To believe that while fasting, taking in nothing other than, let's say, water or some herbal teas, you can effectively detoxify the body. That is also physiologically impossible. But this is not to say fasting is not effective. It is, in fact, very effective, especially for mental emotional conditions. I recommend that highly. And for stimulating alternative or natural medicine. So there's really not a difficulty in telling people the problems with pharmaceutical or Western, standard Western medicine, because most people are in agreement with it that it is ineffective in many cases, that it is not science-based as they purport, that their testings are also, many of the testings they've done are inaccurate. For example, the HIV test being inaccurate.
What do you mean HIV test, for example, is inaccurate?
It's reported, and this is quite common in the internet. Anybody can find this information that you can test positive, but it could be for any one of 60 plus conditions. So it's not so specific that it will always narrow down a particular virus. And the follow-up tests are also considered by those that prefer to use my natural or Chinese medicine ideas first and foremost in treating people.
Yes, and so you're from Chiang Rai originally, which is about an hour away, is that right? Or you practice there? You work between here and there? Tell us about your life right now, because this is quite interesting, even for the doctors watching or people that want to change career or really live their dream or live something not as conventional.
Right. Currently, I work as a full-time doctor at a university hospital in Chiang Rai. University name is Mae Phan Long. It's very pleasant. It's very beautiful. I'm not from Thailand, though. I'm not a Thai person. I'm actually a Pacific Islander, half Jewish Pacific Islander. I am, unfortunately, right now an American citizen, but I am trying to...
Unfortunately?
Yes. Well, if you understand the way things are in the world, you would say the same thing. I am trying to renounce my citizenship if I can, but it takes time and a lot of money to do so.
Exciting. Well, we're going to speak a little bit of exactly, we're starting to get in there into the controversial ideas in your field, because I hear a lot of things, I'm traveling around, I interview quantum physicists, doctors that used to be, doctors and operating, and here we have a kid playing, hi, we're doing an interview. And in the end, we're a little bit lost. What's true, what's not true? Is there some things that you would like to share in your own experience that would be quite interesting for us to know?
Sure. One of the things working here at Dao Garden, usually we get people who are open-minded to